Welcome to TCM Board Formula Series. Today we review Xiao Chai Hu Tang, minor Bupleurum Decoction. It belongs to the category Harmonize the Shaoyang. The fastest memory hook is this: the pivot is stuck, alternating chills and fever with a wiry pulse. By the end, you should recognize the core ingredients, formula hierarchy, pattern picture, major differentials, and modern safety checks. This lesson is for board preparation and professional education. It is not a diagnosis, prescription, or substitute for individualized medical care. Build the formula from its ingredients. Chai Hu vents the Shaoyang and relieves constraint. Huang Qin clears heat from the lesser yang. Zhi Ban Xia harmonizes the stomach and stops nausea. Sheng Zhang assists stomach harmony. Ren Shen supports upright qi. Zhi Gan Cao harmonizes and supports qi. De Zhao nourishes and protects the middle. On an exam, do not memorize the list as isolated names. Link each ingredient to the treatment strategy. The composition should explain why the formula fits its pattern and why a similar formula does not. Now organize the hierarchy. The chief is Chai Hu. The deputy level is Huang Qin. The assistants are Zhi Banxia and Sheng Zhang and Ren Shen. The envoy role is Zhi Gan Cao and De Zhao. Together, the formula harmonizes the Shaoyang, vents constraint and clears heat, harmonizes the stomach and supports upright qi. A useful board habit is to ask what the chief attacks or tonifies, what the deputies reinforce, and how the assistants control side effects or protect the middle. The target pattern is Shaoyang disorder, a pathogen lodged between the exterior and interior. Look for this clinical picture: alternating chills and fever. Bitter taste, dry throat, dizziness. Hypochondriac fullness or discomfort. Poor appetite, nausea, or irritability. The tongue is thin white or slightly yellow coat. The pulse is wiry. The board answer comes from the whole pattern, not one symptom. Match the disease mechanism, the treatment strategy, and the tongue and pulse before selecting the formula. Differentiate carefully. De Chai Hu Tang a Shaoyang disorder plus stronger interior excess and constipation. Chai Hu Gui Zhi Tang a combined Te Yang and Shaoyang signs. Hao Qin Qing Dan Tang a damp heat obstructing the Shaoyang with a greasier coat. When two formulas seem close, identify the single feature that changes the treatment strategy. Ask whether the presentation is excess or deficiency, hot or cold, exterior or interior, and whether phlegm, dampness, food, blood, or sinking qi is the main driver. Safety is part of formula knowledge. Classical cautions include: rare liver injury and interstitial pneumonitis have been reported with related products. Stop and refer for jaundice, dark urine, severe fatigue, new cough, fever, or shortness of breath. Use processed banxia and review pregnancy, liver disease, and product composition. Modern medication review includes: historical safety concerns exist with interferon therapy, specialist review is essential. Zhi Gan Cao adds blood pressure, potassium, cardiac, kidney, and corticosteroid considerations. Use a verified product. Document the complete medication and supplement list, set monitoring parameters, and refer when red flags exceed the scope of routine herbal care. Formula names do not guarantee identical composition or concentration across products. Finish with 5 board pearls. Number 1. Alternating chills and fever. Number 2. Wiry pulse. Number 3. Shaoyang pivot. Number 4. Chai Hu and Huang Qin. Number 5. Watch liver and lung red flags. The one-line recall is: the pivot is stuck, alternating chills and fever with a wiry pulse. Review the ingredient architecture, then practice distinguishing the nearest look-alike formula. This concludes Xiao Chai Hu Tang. Save this lesson for spaced repetition, and always connect board memorization with safe clinical judgment.